That's a very interesting question, and it's been talked about for the last 5 years with a varying number of numbers given. But my assessment, after all is said and done, after you look at all of the studies, I think that if you've got a blood pressure that's less than 130 systolic, which is the top part of the number, and a diastolic blood pressure of 80 or below, that is the number to shoot for, especially if you're older. If you're younger, you might shoot for 120 over 80, and there are a number of studies that suggest that that may be the number for younger people. But in general, I would say that 130 over 80 is the number you should shoot for. But I think one of the most important things about this blood pressure is who should be measuring the blood pressure. And one of the confusing aspects of it is the phenomenon called white coat hypertension,
Yes.
which involves you going to the doctor, and when the doctor takes your blood pressure or the nurse takes your blood pressure is higher than it ordinarily is, which brings us to who really should be taking the blood pressure. And you know who that is? That's you.
We
You
should.
should be doing it at
Absolutely.
home. You should be doing it at home and doing it once or twice a week. And if it is above those numbers of 130 over 80 that I gave you, then you might see the doctor and then talk to him about how you could have it treated. And there are a number of ways of treating blood pressure. The first way is to lose weight. Next is to eat the right, healthy, appropriate foods. And eat small portions of those foods and have a normal weight. Then, of course, these are the basic things, but it starts at home. You having a sphygmomanometer, which is the term we use for the blood pressure apparatus, and you using that and taking it when you're home comfortably seating, because then you'll know what your real blood pressure is. Yes, going to the doctor and nurse getting the blood pressure is good as well, but the monitoring of it by you at home is what makes a difference, because if you have high blood pressure and you know it and you take medication but it's not controlled, what good is that? That doesn't matter. What does matter is that if you monitor yourself and you know that it's around 120, 130 over 80, and that's where it stays, wonderful. If you find out you have high blood pressure and you're taking blood pressure medication and your blood pressure is still not controlled, then what's the merit? There is none. So when push comes to shove, we go back to the consideration that you should be monitoring your blood pressure yourself at home and letting your doctor know how you're doing it. And then he can advise you as to whether you need more or less blood pressure medication. And